Welcome back to American Medicine Today. I'm alongside Dr. Bonati, and we're going to talk about spinal decompressions. So, Dr. Bonati, why are these so important, and why are some being, kind of confused into hardware fusion surgeries?
The training programs today in the spine, they are totally wrong.
Why?
Because the majority of the individuals are being trained in fusions. They are putting for the next year $12 billion directed to do new types of fusions.
Right.
And those fusions are associated with biomaterials that they are going to create a stronger fusion.
Right.
The problem is not the fusion.
Mm-hmm.
You don't need to fuse the vertebrae. Mother Nature didn't put those vertebrae there for you to fuse it. Thus, they need to move. What you need to know is what is the problem and what you need to do to solve the problem. Spinal decompression means that you're going to open something on the spine and you're going to decompress something.
Mm-hmm.
The problem is if you don't know what you are doing and why you are doing it,
yes,
then the results are going to be pathetic. Not only you are going to create an excess of scarring, but at the same time you're going to create a lack of opportunity to correct the problem if you don't understand exactly what needs to be done.
Right.
It's very surprising to see in more and more patients that I see terminologies like laser surgery.
Right.
Laser is an instrument. If you don't know what you are going to do with a laser, then you shouldn't be using the laser.
Let me preface this by saying, though, that you were the first to obtain FDA approval for the holmium YAG laser implemented in spine surgery for humans, but you had the knowledge to know when it should be applied and how. And that's what you're getting into. In the wrong hands, it can be purely a hoax, and if it's not used in the proper fashion.
Unfortunately, the laser is nothing more than a tool.
Mm-hmm.
And if you don't know how to use that instrument can be lethal.
Sure.
So the problem with using laser is you need to know that, for example, why are you going to use laser? I used laser in the past because I was thinking that if I can obliterate the posterior primary rami, that is a very small little nerve that is in the joint of the facet, and if you obliterate that nerve, you're not going to change any structure, you're not going to do any damage.
Right.
And that nerve, practically to give you a sensation, when it is creating sensation that is negative for the patient, it means a transformation of that sensation to pain.
Okay.
Well, it's like when you have a bad tooth and somebody comes over and take the nerve from the tooth. So that was the idea.
But what happened?
Well, the problem is then this thing became exported, and an enormous amount of the individuals in medicine, they are doing now, what they call ablation.
Right.
And the ablation is nothing more than what I developed 30 years ago. I don't really like it today because the ablation will work for a few weeks, maybe a few months, but it's going to come with the advantage.
Okay.
Because the body is going to react to that damage created in the nerve, and the nerve is going to create a neuroma. And the neuroma is very painful.
Okay.
So the people will have worse pain than they had before. So I start to abandon some of those techniques when I start to see that instead to be helping was a temporary fixation and that's it.
Right. And others ran with it. It became such a buzzword even today. We do laser spine surgery. And based on your knowledge, we go, well, so what? You're still going to leave the patient in pain.
Well, the same thing is the terminology like we're discussing as decompression. Today, the fact that we can use a scope and the tubes that I develop and look inside, the people start to think that we can do the decompression.
Mm-hmm.
If you don't know what are you doing with the decompression, why are you doing it, you're going to have the same results that you had with the laser.
Right.
So decompression is a technique, but the technique needs to be used in a specific way for specific results. And if you don't understand why are you using, the only thing that you're doing is cutting bone and exposing the dura, and that situation is going to create a scar.
Mm.
And once you start to create a scar, when the patient returns to you, the possibilities to fix the problem for that patient becomes more difficult and more dangerous, because it's the possibility to tear the dura is very, very much right there. When somebody comes to me and they say they are going to do a decompression, two things go in my mind. Or they are going to do an open procedure, and they're going to take a lot of bone and they're going to expose the area. But what is the result you expect? And when are you going to have the result?
Mm-hmm.
If you're going to have the result in 6 months, that means the decompression didn't really work. What happened is that you create the scar tissue now, and maybe the body is helping you to heal something that you create. So decompression is a buzzword. If you're going to look for a doctor that is going to do any surgery on you, the first thing that you need to ask is few questions. And one of the questions is, how long are you in practice? And how many surgeries did you do?
Sure.
So if you don't have experience, you're going to fail. And that's why back surgery is such a difficult specialty, because the results are pretty poor.
People can get help with their spinal issues by visiting the Bonati Spine Institute.
Well, we do sometimes the best.
All right. We'll have more in future episodes of American Medicine Today. Thank you for joining us. And if you would like more information about the Bonati spine procedures, visit askbonati.com or search for our apps. Anytime, anywhere, keyword AMT or keyword Bonati. Thank you for watching.